Welcome to Watch Your Mouth, the podcast of the Ministry of Health and Wellness Oral Health Unit. I'm your host, Dr. Chanel Demstopert, and we're continuing with part 2 of our conversation with Dr. Irving Mckenzie, Chief Dental Officer in the Ministry of Health and Wellness. So, Doc, tell me, what is the biggest challenge facing the public oral health system in Jamaica today? And how is the Ministry of Health and Wellness addressing that issue?
That's a very difficult question because there are many oral health issues. But if I should select one, I would want to address the matter of oral health literacy. And what I mean by oral health literacy, we have Jamaicans are still seeking care from persons who are not trained, who are not knowledgeable about the field of dentistry and health, and as such are putting their lives at tremendous risk of death and disability because we are allowing people who for financial purposes begin to exploit their lack of understanding of the interconnectivity of oral health to systemic health and to their own well-being. And that is a major problem. The Ministry of Health believes that education is an important driver of and an important determinant of good health. So we are big on health education and health promotion. Hence the purpose of this podcast, to bring the message to people that oral health is not simply a matter of hygiene. It's a matter of one's general health and well-being. Dentistry is essential to general health and well-being. Another matter is also access to care. So from a public health perspective, and in answering part of the question we asked early on, we aim to create avenues in terms of access to good quality oral health care under the universal health coverage, access to care and utilization. So we want to improve access to care and utilization for all Jamaicans across the life stages, starting with the antenatal woman or the pregnant woman, straight through to those in later adulthood, the elderly. They're being able to access care. And this care, we believe, should be at the level that is desirable, and it should protect each and every one of us from financial hardship. And that is what the universal health coverage is all about. And we want to play our role in decreasing the burden of chronic non-communicable diseases by helping to mitigate those risk factors for poor general health by just being good oral health physicians.
Earlier in our conversation, Dr. Mckenzie, you would have mentioned that when you just came to Jamaica, the dental surgeons were more so in the metropolitan area.
Yes.
What's the ministry doing then at this time to ensure that underserved communities, not those metropolitan areas, rural Jamaica, volatile communities, is there anything happening in the ministry to ensure that this access to oral health facilities is across the length and breadth of Jamaica?
Well, the ministry has, and we've been rolling out what we call our primary care renewal. From 1978, Jamaica made its debut on the world stage in terms of primary health care. And we strongly believe that primary health care is the vehicle that can get into every nooks and cranny in Jamaica. So the Ministry of Health right now, integrating all aspects of health and health services, where oral health, through our microplan, will ensure that we'll have oral health services in all different levels of health facilities, in the comprehensive health centers,
Mm.
the district health centers, and in community health centers. Normally community health centers may not have much dental facility, but what will be happening through the modality of mobile and portable systems, we'll go to those community facilities that we once never used to go to on specific times to offer dental services, thus improving access. Looking on the mobile modality, we'll be able to reach remote communities. Looking also on a sort of a collaborative approach, because we do have health volunteers, both internal and external, that work with us in various communities providing various levels of care as one aspect. And when we look at our dental communities, both dentists in the private sector and public sector, we do hope to elaborate those partnerships to see how best we can create greater access to quality oral health care services. So the primary care renewal is a fundamental, I call it one, our flagship approach to dealing with oral health, because primary care is bringing care to the people in the community where people are, and ensuring that the care that we are providing is the care that the community requires and at the quality is required. And of course, with the universal health coverage, without causing any financial hardship.
So the 80 facilities you mentioned earlier in the public sector where persons can access oral health care, that's at no cost to the
That has
patient.
no cost to the patient. And of course, we are planning to increase, because we plan to, in some community hospitals, we'll be having oral health services according to our master plan. And we hope also to diversify in offering what we call specialty services. Like currently we're looking at pediatric dentistry, prosthodontics, oral surgery. I know Western region, Western children will soon open,
Yes,
and will
yes.
offer a higher level of quality of care in terms of our pediatric dentistry there. And we do believe we are going places. And most of all, just to let Jamaicans know that this won't stop you from going to your private practitioner, because we are aimed primarily at those who cannot afford it, and hence create a greater level of equity in access to healthcare services.
Okay, thanks for that, Dr. Mac. When we think about these messages, we often say, all right, the public is listening. But you have members of the dental team listening, because as the chief dental officer, we know that you're able to impart knowledge. What could be done to increase public awareness and education for how persons can take care of their oral health by members of the dental team? Would you have any advice for them if they're
Oh,
listening?
okay. You see, I usually say, that the way dentistry is practiced is that the dentists have a heart for prevention. And it is evidence based that the most likely healthcare provider that will call you and remind you of an appointment is the dentist.
That's true.
So dentists are big on prevention. So we call people to remind them, remember the last time you had your teeth done was 6 months ago. So we're reminding you to make your appointment. That is a profound way of addressing health, reminding people of how they need to take care of number one, which is themselves, through having preventative practice. And every year, especially like during this month has been declared by His Excellency the Governor General as the National Oral Health Month.
That's October.
Yes, October. We know we have cancer or breast cancer awareness, and we are all about health. We have mental health and so many aspects of health, and we don't see health in segment, and we see ourselves as a health continuum. So during this month, members of the Dental Association of Jamaica, they are challenged too, and they have been doing this for years. They have been a pioneer in driving this whole focus of health promotion during Oral Health Month and providing services. Then you have the Public Sector Dental Association, JAPDENS, that have been very, very engaged in terms of going elsewhere and partnering and doing health education and health promotion. And then from my own desk, as you rightly say, I call upon all dentists not to be weary in doing good and for us to remind the public that the best patient is the informed patient. The best patient is the patient that understands how important their health is and are motivated to take care of their health. Because remember, our health is our most important resource. Many persons would like to win the lottery, $10 million, $50 million. And I heard somebody said, oh, if I win $100 million, what and what I can buy. And many of us realize that, but if you don't have good health, that $100 million can go overnight and your health yet is not restored. So living healthy is your best resource. And this is what us as oral health practitioners like to preach. It is all about your health. And your health will help to guarantee that quality of life. Your oral health is important for your mental health. We have found in research that there are oral microorganisms that have been found in the brain of persons who have dementia, right? That shows that there's a connection there. I won't say from a scientific perspective that causation is established, but it shows a relationship.
Association.
And when you look on persons with cardiovascular disease, are showing that the oral health does affect one cardiovascular health. And I'm sure we hear all these things. So we help to remind our dental surgeons or dental nurses or dental hygienists and others to spread the good news of prevention. Prevention is better than cure.
You mentioned your workforce again.
Yes.
You mentioned your team again.
Yes.
Suppose someone wants to join this team of dedicated oral health professionals, students watching, persons who may want to change careers. Are there any initiatives in place to improve the training of these oral health professionals in Jamaica?
Most definitely. I'm excited about the Barwin Memorial Scholarship.
Yes.
Yeah, $2.5 billion. That is a great investment by the government and a great initiative by the Ministry of Health to support education of healthcare providers. One of the greatest deterrent in terms of persons becoming an oral health provider has always been the cost of studying dentistry or doing dental hygiene or doing anything in the dental area, which is always very costly. The Barwin Scholarship offers up to as much as $1 million per annum for one to study dentistry. And what is beautiful now is that, I don't want to say Jamaica, that's within the CARICOM region. You have Trinidad, you have Jamaica. In Jamaica, you have two dental institutions. You have one at the University of West Indies, you have the University of Technology. If you want to become an hygienist, you have NCU, and there's UTech. And then there's a laddering process. So if one should become a dental aide working with the government or a dental assistant working in private practice, one could see themselves becoming a dental hygienist first. And after qualifying as an hygienist, to move on probably to become a dentist. Or the other scope that exists, moving from an hygienist to becoming a dental therapist, and from becoming a dental therapist becoming a dentist. So there are many avenues for professional and career advancement. I like to put in a plug for the government because I can say right now that the salary in government isn't bad. And that one becoming an oral health professional, that the government not only pays a reasonable salary, but the government also provides what we call career advancement,
Yeah.
right? And if you talk about work-life balance, I will tell anybody in Jamaica there's no other profession that encourage good work-life balance like dentistry. Some people tell you, say, hey, I don't work on Saturdays.
Mhm.
My wife is a medical doctor. She get called out at night. And people, you'll know that dentistry helps you with those work-life balance. It is economically rewarding. And let me tell you, it is good to see a smile on the face of a child. It is good to see a smile in the eyes of an elderly person. And I think nothing else epitomizes good health like good oral health. I may be biased, but for those guys with their six pack, I said, no, nothing beat that smile.
Nothing beats a smile. We've spoken a lot, Dr. Mckenzie, and you've shared so much, focusing on Jamaica, yes. But how does Jamaica compare to the rest of the world in terms of oral health, in terms of best practices? You've mentioned a little bit about CARICOM or CARICOM neighbors. What's happening when it comes to Jamaica compared to the Caribbean and the rest of the world?
Jamaica, we have a saying, we think globally and act locally. From a global perspective, and I go back to United Nations and the World Health Organization, there is a global health problem in terms of oral health. Over 3.5 billion persons globally suffer from the ravages of poor oral health.
Wow.
And when you compare oral health to chronic non-communicable diseases, it don't even come close.
You said
3.5 billion.
Sounds like half the world's
That's like half the world population suffer from poor oral health. The WHO has recently published what is called the Global Oral Health Report and Status Report. And when we look at the Caribbean, the picture is not a good picture. We see, like from Jamaica and many other Caribbean countries, that are the children between 0 to 9 untreated dental caries being about 45%. Individual 5+ years and older the prevalence of untreated dental caries in permanent teeth being about 32%. We're looking at periodontal disease, like in Jamaica, within the age group say 15 and older, being 22.7%. And when we look at oral cancers, it tends to be increasing globally. And we're wondering what is happening globally in terms of oral health and what lessons we can learn. One of the profound lessons we have learned from public health is that there is this whole matter of oral health and nutrition. And here we're looking at, for example, sugars. Jamaicans consume an extraordinary amount of sugar. If you put it in a thing, it's like 33 and a half teaspoon of sugar per day, which is far too much. Far too much. And that kind of dietary indiscretion is leading to a lot of oral health problems. Then, as I spoke earlier about the non-nutritive areas like the smoking, tobacco smoking, the alcohol consumption, and other things that we do, we realize that it is not just here, it is elsewhere. So we look at North America, not like in North America where they have a lot of dental surgeons. But then when we look in certain communities, like communities of where persons are in terms of their socioeconomic status is not so high, their oral health condition reflect and mirror what many of our developing countries. So what we find from a public health perspective that yes, there is a significant oral health disparity or inequity in terms of access to care. And because of that, the WHO have focused on oral health for special attention by ensuring that governments around the world focus a lot and reorient their health system towards prevention. And that there should be a greater investment in oral health. And I like the thing, not a greater spending, but a greater investment in oral health. Because if you look at it, if you look on your HDI indicator, the health of your nation is as important as your GDP and your GNP, your gross national product. So, what are we learning in terms of lessons from overseas? We are learning that, and as we know before, that we have to have a strong program focusing on prevention. The life cycle approach is a strategic approach, especially starting with the mothers, because when you empower women to act progressively and in the interest of healthcare and oral health, we believe it will pass on those values and virtues to their children.
Yes.
So the kids now will begin to follow and mimic what their parents do and begin to, from a very early age, being exposed to good and healthy lifestyle practices, and then we begin to mimic that. The other thing is the whole aspect of the investment. Why the investment? Because we want to protect the vulnerable persons, the most vulnerable and at-risk persons in our society from this catastrophic health expenditure. We can't afford to pay everybody everything, but if your what you earn can be used to support your families and not be used to be paying for something that you could have prevented
Yeah.
is worth a lot. So I think we are on the right track in terms of putting in the right type of public health intervention strategies by focusing on prevention, by focusing on the family, by using the life cycle approach, by ensuring that we address the workforce issues, that we not only train dentists, but we train dental nurse, therapists, dental hygienist, dental technician, dental assistant, and that we look at providing access to the most vulnerable and to those who can afford to pay and have third party insurance, that they can access good dental care within any means that they can. And I think this will then get us to where we need to go according to the Sustainable Development Goals of the United Nations and the WHO and our own Vision 2030, that we will indeed become the country that we want to live, raise our families, and do business
Yes.
in a smiling way.
Dr. Mckenzie, every guest on Watch Your Mouth is asked to give us one parting word.
One word:
One word, sort of like a last lick. What's yours?
hope.
Hope. Okay.
I have so much hope that Jamaica will indeed be the place from a dental perspective where we want to live,
Mm.
do business, and have our children, because we're going to make Jamaica smile.
Nice. Hope. I hope that our viewers enjoyed this episode. Thanks for joining us today. I'm Dr. Chanel Dempster-Peart, and this has been another episode in our oral health series. Stay tuned for more episodes, and until next time, keep smiling and taking great care of your oral health. A happy mouth is a happy body.